How one of Rochester's most famous residents played a role in determining what nurses need to know in order to do their job. WXXI's Carlette Clear opens a little-known page in our history book.
This is the cradle of nursing right here. This is where it all happened. This is where it all got started. And Susan B. Anthony was a part of that.
Susan B. Anthony is best known for her passionate fight for women's suffrage. But in 1902, she put her oratorical skills to use on another cause, improving the nursing profession.
The only title really that nurses had had up to that point was trained nurse, and really anybody could be a trained nurse. Hopefully you'd had some education, but you might have just done it as an apprentice or picked it up along the way. You didn't necessarily have to have gone to school.
A statewide nurses convention was held in Rochester, and some were calling for standardized training for all nurses. Anthony was the keynote speaker.
Anthony, who was 82 years old at the time, spent the whole day, stayed on the podium the whole day, attended all of the meetings, and actually spoke twice, and was a strong advocate to say that yes, there should be standardized training.
She spoke about the difficulties that that the women in general, and especially women in medicine, had overcome to that point, talking about the difficulties that the first female physicians had in training, and was foreseeing sometime in the future when nurses would need to have college degrees.
Anthony knew firsthand about bedside care. The women's rights activist had helped doctor her brother Daniel back to health after he suffered a gunshot wound and was bleeding internally.
She was among those who sat by his bed for 5 weeks, applying direct pressure to that artery. And it actually, much to the surprise of the doctors, it healed, and he recovered from that.
Anthony was also a friend to one of the world's most famous nurses, Clara Barton, founder of the American Red Cross. During the 1902 convention, Anthony helped inspire Eva Allerton and Sophia Palmer of the fledgling New York State Nursing Association. Allerton drafted a plan to move forward.
Between the two of them, they were really some of the driving force between getting the Armstrong Act structured and pushed through. Eva was the one who contacted Senator Armstrong, State Senator Armstrong, and got him interested. She also really kept a pulse on the opinions regarding the bill.
6 months after Anthony's rousing speeches, the New York State Legislature adopted the Armstrong Act. This law placed all nursing schools under the University of New York and required a common set of courses for graduation. The bill also created the title of Registered Nurse, or RN. A year later, Canadian immigrant Ida Jane Anderson became the first registered nurse in New York State. She graduated from Rochester Homeopathic Hospital School of Nursing, today's Genesee Hospital. Now in Monroe County, there are over 9,000 and 208,000 in New York, compared to 2,500 trained nurses in the early 1900s.
As a registered nurse, we work in many settings. We can work in a hospital, we can work in the community, we can work in the jail system, we can work in doctor's offices. And what we do is really assess the whole patient, mind, body, spirit, and perform those interventions.
Hughes says Susan B. Anthony knew that the day would come that trained nurses would need college degrees. That day has come and continues to move forward.
Nursing is so much like the work around suffrage. You're working long term. Sometimes you don't get to see the great end result of what you've done, but you're in people's most intimate moments of their life when they're in pain and suffering and they're dealing with life and death.
For Need to Know, I'm Carlette Clare.
WXXI's Carlette Clear. Her report is part of a year-long occasional series on Susan B. Anthony and the 90th anniversary of the 19th Amendment, giving women the right to vote in 1920. The Susan B. Anthony House has created a group called Nursing Friends of Susan B. Anthony. They meet regularly to explore the history of nursing, and they are in the very early stages of developing a credited course for nurses that would be taught in Susan B. Anthony's carriage house. It's time now for the business section.